Hello. Today I'm going to discuss about a case which I have seen in 2018. This girl, when she came in, she was 8 years old and she started to show symptoms of eczema since 1 to 2 years old. Since then, her eczema has been chronic despite treatment from hospitals, which traditional method has been used, including soap-free wash, aqueous cream, steroid creams, antihistamines, and anything that can stop the itchiness. But I'm going to show you what is the difference between 7 days with review holistic disease management, which is very different from the traditional management. From the pictures that you are seeing now, it is a very typical atopic dermatitis. The skin is very dry and it is very itchy, especially at night. The patches are red to brown or gray, especially at hands, feet, ankles, wrists, neck, upper chest, lids, inside the bands of the elbows and knees. In infants, it can be on the face and scalp. There might be small raised bumps which may leak fluid and crust over when scratched. It's thickened, cracked, and scaly, and often it can be bloody too. The skin could be raw or sensitive, swollen when stretching. Atopic dermatitis can happen at any age, including mostly below 5 years old, but it also can happen in adulthood. It is chronic and the itchiness is very intense. So most people, they would like to use soap-free wash and moisturizer to relieve it, but that's only relieve the dry skin. The fundamental cause of it is genetic defect at the barrier area of the skin. This one, surely we can cater the defect. We cannot change the genes, however, we can change the environment of the skin, lead to the balance of the skin, hence you don't have the symptoms like that. It is linked to the family history, hair fever, asthma, and any allergies. It is also triggered by heat and sweat. That is because when we are hot, our blood vessels will dilate and that will cause inflammation and itchiness. The sweat, when the water evaporates, the salt will remain, and the salt will gonna attract the water from the skin and suck out the water and cause more itchiness and irritation. Due to the fact that this kind of eczema is chronic and she has been using traditional treatment including steroid for many years, we decided to perform an allergen blood test for her, IgE and IgG, to find out what are the things that she's allergic to. For this case, when I saw this patient, she claimed that her level of itchiness is 10 out of 10 and the sleeplessness is 8 out of 10. The scorage measures 75.8, which is pointing to severe eczema, as you can see from the pictures. So our immediate aim is to reduce level itchiness, to heal the wound, to improve the quality of sleep, and to increase the skin moisture. Although she has been using steroid creams, soap-free wash, moisturizer, even the Vaseline, things like that, I restructured the whole thing. So this is what I gave to her in my first visit. Also, from the picture, you can see that she's wearing a necklace, right? So with atopic dermatitis, we should not wear any accessories at all due to the rubbing actions of the accessories. It can damage the barrier of the skin and cause more itchiness. So take off all the accessories. Now I'm showing you after 7 days of treatment what is she now? Bear in mind, she was using steroid cream in the beginning before she came, right? So this won't be the effect of the steroid cream because she has been using it since young. There are several complications that atopic dermatitis can lead to. The first thing is psychological issues. A lot of my patients, they have low self-esteem, or they are not having the good relationship with in the future due to a lot of constant scars and itchiness of the skin, causing bad-tempered. So that will affect their relationship and self-esteem. Skin infection is another common one. Some of them, when they came, was so severe that the wounds got infected and hence they need the help from antibiotic. Third one is the growth issues. If they are children, they may experience growth issue, hence we need to monitor their growth constantly. This is because when they're not sleeping well, the growth hormone won't produce as much, so that might affect their growth. And then we come with scars. So we often have to deal with those scars for scar reductions after they reach stabilization stage. I would like to congratulate this girl because she is in this 80% of population that responds to the Review Holistic Disease Management Program. We cannot guarantee 100% responding rate, but there is an 80% of responding rate in our patients. So far, we have dealt with about 3,000 patients now. So she's in that 80% of population. She is now 5 years past. She is now from 8 to 13. So she's 13 years old now. She has been good. No flakes at all until now. Of course, this is only the first week. We managed her up to 60 days. We manage her up to 60 days to ensure everything is fine. So after 60 days, she has been released from the management program due to the fact that 2 times that we see her, she is very stable. She's no flakes, so she did not have to come again. So this is our program this week. If you would like to know any sort of skin management, you may comment at the comment space, and then we may make a video for you for the explanation.